And now these three remain: faith, hope, and love. But the greatest of these is love. Today's topic of discussion is gingival cyst of adult. This cyst is a developmental odontogenic cyst of the gingival soft tissue. It is derived from the rest of the dental lamina, and it is made up of an embryonic epithelium consisting of cuboidal cells. It is a rather uncommon cyst of the gingival soft tissue, and it occurs on the free or attached gingiva. So here in this picture you can see the gingival cyst of adults present in the free gingiva. Talking about the etiology and pathogenesis, there are four theories to describe the pathogenesis of this cyst. First theory says that it arises from the heterotrophic glandular tissue present in the gingiva. Secondly, degenerative changes in the proliferating epithelium may also lead to the gingival cyst of adults. Thirdly, remnants of the dental lamina or enamel organ or the epithelial islands of the periodontal membrane is responsible for this cyst. And fourthly, the traumatic implantation of the epithelium may lead to the gingival cyst of the adults. Out of these four concepts, this third and the fourth concept is more valid. There are two recognizable forms of the gingival cysts of the adults. One is those arising from the cystic transformation of the dental lamina or the res of Ceres, and second are those arising from the traumatic implantation of the surface epithelium. Wysocki and colleagues have described the gingival cysts of adults as an extraosseous counterpart of the lateral periodontal cyst. We will have a detailed lecture on lateral periodontal cyst later. But here, just remember that the gingival cyst of adults is the extraosseous counterpart of the lateral periodontal cyst. Now, note here that the gingival cyst of adult and the lateral periodontal cyst have similar clinical behavior, morphologic characteristics, anatomic site, and age predilection. So because of these similarities, they are considered the counterparts of each other. Now the clinical features of the gingival cysts of the adults. It occurs in adults more than 40 years of age, and the most common site is in the mandibular bicuspid and cuspid region. It occurs as a small swelling less than 1 centimeter in diameter, and it is well circumscribed, painless, and is present on the gingiva, either the free gingiva or the attached gingiva. Here you can see this gingival cyst of adult, a classic lesion. Talking about the radiologic features, there are no obvious radiologic features shown as this lesion is soft tissue lesion. It may sometimes cause superficial erosion of the cortical bone. As you can see in this picture, here you can see a little erosion of the cortical bone. Histopathology of the gingival cyst of adult, it is a true cyst consisting of a cavity which is lined by pathologic epithelium, and this cavity contains fluid. The epithelium is similar to that of the lateral periodontal cyst. The epithelium is 1 to several cell thick, and it is made up of stratified squamous epithelium. Glycogen-rich clear cells may also be seen in the epithelium, and sometimes the epithelium shows focal thickening and plaque formation. The connective tissue wall of the gingival cyst of the adult contains dental lamina rests, glycogen-rich clear cells, and the cyst lies freely in the connective tissue of the gingiva. So here in this picture you can see the superficial gingival epithelium, the fibrous connective tissue of the gingiva, And in this fibrous connective tissue, there lies a cyst. This is the gingival cyst of the adult. And this cyst is lined with a thin odontogenic epithelium which is stratified squamous, and the cells are low cuboidal. Sometimes clear cells may be found in this cystic lining epithelium. So this is the classic histopathological picture of gingival cyst of the adult. A cyst lying freely in the connective tissue of the gingiva. Now the treatment of this cyst is local surgical excision, and there are no reported cases of recurrence. The next lecture will be on the lateral periodontal cyst. That's all for now. Thanks for watching. Happy studying.